Hello, everyone, and welcome to today's webinar, Ambient AI Isn't Enough. Here's what's missing. Thank you so much for joining us. Before we begin, I'll walk us through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have issues with audio or visual, try refreshing your browser. You can also submit any technical questions into the Q&A box. We're here to help. With that, I'm pleased to introduce today's speakers, Sriram Chakravarti, co-founder and CTO of Avaamo, and Dr. Srujal H. Shah, president of Spark Sleep Solutions. Thank you, Dr. Shah and Sriram, for being here today. I'll now turn the floor over to you.
Hello, everybody. A very good morning to all of you. Thank you so much for joining us as a part of this session. Let's jump straight in, right? As all of you probably heard, the clinicians today spend an inordinate amount of time, as much as 50% of their time of their workday, in documenting. And this is known as pajama time. And that is also directly impacting the quality of patient care and is leading to clinicians' burnout. And there's all kinds of data, all kinds of research that has been done around this problem, right? And this is really something that where we have seen a really mushrooming set of products and technology that have come to the forefront in really solving this problem. And this is popularly known as ambient scribing. And this is really taking AI technology to listen to the patient and the physician encounter and scribing it. And what we have seen is some of the initial results. There have been a lot of success that clinicians have seen that these new technologies, this ambient scribe technology, has really helped reduce the time and effort it takes for these physicians to document what has happened and construct that into structured clinical notes. However, as we have talked to a lot of healthcare practitioners, whether it is physicians, specialists, nurses, nurse practitioners, what we are realizing is the simple transcription of the patient encounter is just not sufficient. We have heard cases where, especially specialties, doctors who are part of the specialty, who are used to taking notes in a specific way, where ailments mean something else, are finding these tools extremely unsatisfying. The initial job of taking a conversation, a 15-20 minute conversation between the patient and physician, and converting them into a SOAP note format is what most of these products do. But that's really not solving some of the deeper challenges that physicians have in terms of how the information is captured, how the ailments are captured and translated. EHR integration remains a fairly big problem. We are seeing a lot of these products expect the physician to copy paste the SOAP note back into an EHR. And that really is not helping the overall productivity of the physician. And last but not least, significant costs. So I am excited to bring Dr. Srujal Shah to the session. Dr. Srujal is a specialist. He treats obstructive sleep apnea. He does a hyper specialty and is one of the fastest growing practices in the country. And let's go ahead and hear him talk about the challenges with various different ambient technologies and how he's expecting some of these solutions to solve it for them. Hello, doctor. Thank you so much for your time. Dr. Shah, can you tell us briefly about your specialty?
Sure. So my practice, located in Northern California, I specialize in the treatment of sleep apnea and snoring, basically durable medical equipment for patients who cannot tolerate the CPAP machine. So we customize mandibular advancement devices after evaluating the patients. We go through a manufacturing process, fitting the patients with their devices and then several follow-up visits for assessment of efficacy and comfort, as well as coordinating care with their referring physicians, such as their sleep physicians or cardiologists, to ensure that the treatment's working well. And then I also have a second segment in my practice focused on TMD and oral facial pain.
Great. So, Dr. Shah, I know you have tried out a few of these ambient products. What has been your experience so far with various ambient technologies, and where do you think are the challenges?
It's interesting because I've tried other systems, but they're usually very catered towards much larger organizations. And having, being a group practice like myself, relatively smaller practice, I really needed something that was more tailored or customized towards, my practice in all different aspects, right? With the terminology is very different in what I do compared to other practices. That's a big factor.
Right.
And some of these systems, because they're geared more towards higher organizations, a lot of the things don't just fit in my model. Like the pricing is too high, or it's just requiring months of training, or things that just didn't really fit with what our needs were.
Right. So can you tell me a bit more about, when you are done with an encounter with a patient, you're done with an appointment, in addition to documenting clinical notes,
Mhm.
what else takes up your time? It's what's popularly called as pajama time, where you spend a lot of time documenting after the visit. So in addition to the clinical notes, can you tell us briefly about where else do you spend the time?
Yeah, reviewing actually patient information. So they might have a chart and then there's 50 documents in there, and being able to compile that information to summarize for me before I walk in the room
Mhm.
has been one of the more phenomenal things. I think that has helped me a lot. But also, when you think about the integration, I think what I really appreciated about Avamo's system and what you guys have done for us is the personalization, the handholding, and making sure that everything was integrated with our EHR so well.
Mhm.
So it really helped reduce my workload patient to patient. I think I'm saving a lot of time each and every day. I think if we think about time it takes to, even after we're done seeing patients, that we have to stay in the office to wrap up everything, and how quickly can we get out of there to get home to our families. I didn't want a separate system where it was all clunky and going through different windows and different things like that, because just because the system cannot integrate with our EHR. And so that was, we've gone through those struggles. It was a very tedious process for us. And this is just seamless. Medication ordering is another one. Like if I want to order meds or put in labs and other things, it's just can be done automated through the system. It's not just limited to just one task, like transcribing notes or something like that. It can do so much. So it's been a game changer in that sense.
No, it's great. I think you highlighted on a lot of very important points, which is, the pre-visit summary, the post-visit, orders, codes, after visit codes. Those are all like important things that we focus on. Now, you touched upon something that is also interesting, which is you talked about affordability
Mhm.
of these kinds of technologies. Talk to us a bit about, when you say affordability, what are you talking here?
Well, I mean, you know, for for a company who is looking to serve small businesses or group practices, which is what we are, then you have to kind of see it from our perspective, right? And a lot of times when we're looking for solutions, we might find really good solutions out there from other companies, But when the price is, to the level of like commercial level or hospital type scale, where we're talking thousands of dollars a month per provider, there's, fees and other things, it just doesn't make sense. And so our staff and our chief operating officer, they get excited about products, but then have to quickly weed them out because it just doesn't meet our demands or our needs, and our limitations, frankly. So I think the nice thing with with the Avaamo system was it was at a price point that made sense for us and that we could manage, and we could quickly implement. Which all of those things, are so important when you're so busy running the office all day. We really
Yeah.
want things that just, kind of plug and play type of stuff, and that where we're not burdened and having to calculate the ROI and if all of this even makes sense for us. It just made sense from step one. So it was very quick to integrate and to launch.
Cool. Thank you so much for your time, Dr. Shah. That was excellent.
Sure.
We have been fortunate to work with some of the leading healthcare providers in this nation, the largest healthcare providers. We have, just in the last 12 months, automated more than 200 million patient interactions for various different kinds of scheduling, medication refill, and different forms of patient request. And we have also been fortunate to be trusted by some of these largest healthcare providers. And what you heard earlier from Dr. Srujal, from a viewpoint of a specialist in a small practice, is true for a lot of these large hospitals as well. The three fundamental problems is really what's missing with most of the ambient solutions today. And Dr. Srujal summarized this well. The end-to-end patient journey is more than just transcribing what's going on between the physician and the patient. All the way from the time the patient enters the room where the physician is going to start talking to them, all the way to what really happens after the patient leaves, is a big journey. And what you will see is a lot of this information remains not captured. And we're going to show you how this information can be interestingly captured and brought into the process. Specialties, 200 plus specialties today, and there is a lot of differences in how these specialties work with patients. The amount of time each one of them spend, what happens before, what happens after, the specific terms that are used during the interaction, all those need to be captured along with the proper ICD codes. The after visit summary has to be done using the proper language that's specific for the specialty. A lot of this is missed. And last but not least, a solution where, in addition to the technology innovation, a pricing innovation that is making it affordable, not just for the largest healthcare providers, but for all the physicians who want to use this technology and various aspects and various different caregivers, nurses and nurse practitioners who can also leverage this technology. That is really what we are trying to solve with Avaamo Ambient. It's a new technology that we are bringing to the table after spending hours, hundreds of hours with various different healthcare providers and really understanding the challenges and bringing to the table an end-to-end solution for really solving this problem. So without any further ado, let's jump in and let's take a look at the product. So what I'm going to show you now is I'm going to show you three aspects of the product. What I'm going to do is I'm going to show you from a physician standpoint what really happens when the interaction starts, what happens after the interaction with the patient ends, and I'm also going to show you a third view a view from the standpoint of the administrators. Usually, the doctors get to see a certain set of information. The administrators get to see a different set of information. So we'll also look at the dashboard to see how much value somebody is going to get from this. So let's jump in. All right, here is the view for the physician who's coming in. This is Dr. Paul Hathaway. He has a quick view of all the different appointments that he has today, all neatly summarized in front of him. Doesn't have to go to 10 different applications to find this information. His immediate appointment is with Susan Matthews, and it's right here, nicely summarized. You can click on it and quickly get a view right before the appointment starts and get a sense of everything that he needs to know about his patient. And what we have done here is what is called as pre-charting, where instead of going through 20 different EHR screens, and Dr. Sujal mentioned this, a lot of time is spent before they even enter the room to meet the patient. Who is this patient? What is the last time they came? What are the problems that they've had? What kind of allergies they have? Kinds of medication, all neatly summarized in a way that can be quickly consumed by the physician. And you have all the different formats in which the EHR expects this information to be captured. Here again, every large healthcare provider and a practice typically defines the SOAP format that they want to use for that particular specialty. So what we are able to do is pull in this formatted information, this format from the EHR, whether it's Epic, whether it's Cerner, Dr. Chrono, whatever your EHR might be, it pulls in this information right here for you. So this is standardized format that the practice has decided. And it also gives the doctor option to further adjust any of these SOAP formats if needed, specific to what they want. And there you have started. And you can quickly kind of, start your recording. You can get your patient's consent, which is important for a lot of this technology, record it, and get started with your encounter. From this point onwards.
Well, I see that you've had to deal with that pesky cough. Sorry about that. Can you give me a little more detail?
Hey, so this cough is driving me crazy. It's been hanging around for about 2 weeks now, and it's not getting any better.
I'm really sorry to hear that. It sounds difficult. Has the nature of the cough changed at all over the last 2 weeks?
It started off as just a little.
All right, so there you have Dr. Hathaway has completed the encounter. And once the encounter is done, click a button to generate the note. And one of the really important things that we do is however long the encounter might be. It could be 20 minutes, it could be 30 minutes. We are able to generate the report, the note, in less than 5 seconds. It's guaranteed generation of notes in 5 seconds. So what this does is the physician doesn't have to wait. Right when the patient is there, they can look at the generated note. They can see what is wrong with any of the fields that have been filled in and fix it right away. So let's take a look at the second piece of the puzzle, which is what happens after the note has been generated. All right, so now let's look at the generated note. And this could be viewed on a mobile screen. This could be viewed on a desktop. It's multimodality by default. And even the earliest thing that we saw where the physician was doing the recording on mobile, they could do it on a desktop too, fully integrated into an Epic Hyperspace or any of the desktop tools that you might have. So here you have the full note available for the interaction that the doctor had with the patient. And you have all these different fields captured nicely based on the SOAP format defined, HPI, symptoms, and you can look at how it understands specific specialty. So here you're seeing this instant where the patient has talked about their symptoms, and the doctor has made a note that this pattern is consistent with a sacroiliac joint. SI is the term that he used. And right here, you can look at the evidence in terms of where did this conversation happen and what was said. And if you notice the transcript, the doctor just said possible SI involvement, and the product has the appropriate models already in place for these specialties, so it knows that this is a sacroiliac joint. The term SI could mean something completely different in a behavioral medication kind of a situation. So these are all specific terms that we are able to pull and we are able to retain. You can also see the AVS, the after visit summary, getting automatically generated, jargon-free, in simple language that patients can understand, where you have details on what has happened, what kind of medication has been provided, and various different options, which is consistent with the settings in terms of how this information gets sent to the patient, all from here. You also have all the ICD codes automatically generated based on the encounter. So the ICD codes are defined by the practice. These are from well-defined ICD codes. Every practice has picked and selected the ICD codes. And these are really important from a billing perspective. And every practice spends hours making sure the doctor has selected the right ICD codes so the billing information is done properly. With the Avaamo Ambient product, we take care of all that as a part of the overall interaction, where we are able to automatically pull in the ICD codes. We are also able to show all the different orders and follow-ups that the physician mentioned as a part of this encounter as well. There is a follow-up for a CBC test, and right from here, those tests could be ordered. This is, again, full end-to-end integration with the EHR, and you're able to kind of schedule it. And the physician can do this right when the patient is in the room and make sure that they can schedule an appointment at the earliest possible time, saving a lot of time and effort for the patient. You don't have to worry about scheduling another one. You can also see that various different medication orders are right here, where they can pick and choose the order, send it to the appropriate pharmacy based on what has already been defined in the EHR, based on the patient's preference, and all that can be done from a single click right from here. After all this is done, the last step is really kind of showing you how all this information is captured, made available to the patient in simple ways that they can look at and directly pen this to the EHR. No need to copy paste anymore. The pen to EHR is a single click action that takes all this information and updates the appropriate fields in the EHR without any additional work by the physician. So there you go. So you saw the encounter and you saw what is happening as a part of the encounter, all the different pre-visit integrations as a part of it. Now you saw what happened after the encounter and how we are able to bring in a lot of post-visit information, integrated actionable events right here. And now let's jump back in where we'll show you the third piece of the puzzle, which is really bringing all this together for somebody like a CMIO who's looking at this and saying, okay, we started implementing ambient and we started to have a cohort of physicians and a cohort of nurses in different practices starting off on it. Let's look at what's going on. So what we also provide is a dashboard that gives full end-to-end visibility of how these clinicians are not only providing an explicit thumbs up and thumbs down kind of feedback, but more implicit usage of and seeing value from this ambient AI technology. Number of encounters, what's the kind of implicit feedback based on the follow-up assignments, procedures, medication orders, and ICD codes that have been automatically generated by the system. So as you see more and more of these getting generated and getting used, it means it's reducing a significant amount of time that the physicians would take, as well as the rest of the people as part of the practice would take, making sure they get this information right. So this is really kind of showing how ambient can really benefit the physician, not only during the encounter, but everything before and after. So we are really excited about this ambient AI technology. And what we are doing is really solving the three key fundamental problems that we talked about. One, end-to-end AI, not just the encounter and real-time node generation. That's the easy part. Everything before and after. We call this the first mile and the last mile problem. The first mile is really helping the physician to really know before even he enters the room, what is it that he needs to do as he is talking to this patient. Pre-charting information, neatly summarized. The specialty-specific listening modules are already enabled for the specific specialty, so the physician can be rest assured that in he's using these terms, they are already embedded in the system. And deep integration into EHR. These are not straightforward. They take a lot of time and effort, and it comes with years and years of practice in terms of connecting to these EHR systems and bringing in the right information for the physician. The last mile is also what you saw, and when I showed you the post encounter, everything from after visit summary, nicely created in a format that can be easily understood by the patient, integrated coding, ICD codes, which saves a lot of time and effort and streamlines billing, medication, procedural ordering. All this is automated where it still shows up, the physician still controls and decides when to place those orders, but everything is done and automated as part of Avaamo Ambient. The second problem that we solve is really understanding that there are a lot of specialties, 200 plus specialties that we support out of the box, and every specialty is different. Everything from how the encounter happens. If you are a heart surgeon who's coming in for a post appointment after a surgery, what happens, the patient consultation time and what really happens during the time is very different from when you are a general practitioner who's meeting up with your patient. Everything from pre and post visit information that is captured and information that needs to be captured are very different. The terminology is very different. So what we have done is we have created these custom models specifically for these specialties, and we allow for customization based on these specialties. Last but not least, as I said, affordability is a big problem. And there is no product out there that makes it easy for not just large enterprises who have thousands of physicians to consume products like this, but also smaller practices. We are announcing a 99-cent per encounter pricing, which makes it really easy for anybody to really think about this and saying, okay, I am paying based on usage, I'm paying based on encounter, and I'm also paying so that I can get not just my physicians, but everybody who is part of the medical practice in. And I was talking to, a large healthcare provider. They said, they are rolling out Ambient, but it's so cost prohibitive that they are rolling it out only for certain departments and only for doctors and not nobody else. With an innovative pricing model, we want to make sure that we are democratizing the access and everybody in the medical practice can make use of a technology like Avaamo Ambient. So with that, hopefully you're all equally excited about what Avaamo Ambient brings to the table, and we will take questions and from here onwards. Thank you. All right, I see a few questions have come in on the chat. Let me take a few and answer them. How accurate is your product? How do you prevent hallucinations? It's a great question. So Avaamo has been in the industry for many years now. We have an agentic AI platform that's deployed in hundreds of large enterprises, many healthcare organizations. The top 5 healthcare organizations in this country use our platform. And as a part of the same underlying technology is where we have spent a lot of time and effort in building what we call as agentic framework that really puts guardrails to make sure that there is no hallucination, zero hallucinations. And there are 3 levels of hallucination. One is at the platform level, where we make sure that we are tracking and ensuring that any of the output that's generated is devoid of bias. The next level is organizational hallucination prevention, in this case, specialty, where it is specific to every specialty, where we know the specific terms and what it means and preventing hallucinations on that. And the topmost level is customizations that specific physicians, specific practices can add to make sure that we are taking care of specific business terms that means specific things for the organization. So we pretty much guarantee zero hallucinations using the Avaamo Ambient product. Here's another question. Is the technology compliant with HIPAA and other healthcare regulations? Absolutely. As I was mentioning earlier, we do work with large healthcare providers, so HIPAA is stable stakes. We also have various different forms of PII redaction, PII, PHI data, ePHI data. All this is something that is taken care of by the basic platform to ensure that we can check all the boxes that are necessary for deployment of a product like this in a safe and secure manner to your patients. That's an interesting one. Can Avaamo Ambient adapt to different documentation styles without requiring clinicians to change their habits? It's a good one. And this is something that has come up a few times, and we know that as a lot of products that expect the clinicians to change the way they're generating the SOAP notes because that's just the format they support. But we have designed to adopt various documentation styles, allowing clinicians to maintain their natural tone-taking, note-taking habits. Some clinicians, as we know, like detailed, comprehensive notes, while others are more concise and precise. That's why this Avaamo Ambient is not a one-size-fits-all model. Clinicians have the flexibility to choose their preferred documentation style, making the experience seamless. Okay, the last one. Are you sure you're offering a 99 cents per interaction? Absolutely. We do want to really democratize access, and that's really one of the key feedback that we got, affordability. We urge you to reach out to us, sales at Avaamo, or reach out to any of us, and we're happy to take this conversation forward and show you how we can provide value. Thank you so much for all these questions.
That is all the time we have for today. I want to thank Dr. Shah and Sri Ram for an excellent presentation, and thank you to Avaamo for sponsoring today's webinar. Thank you so much for joining us, and we hope to see you soon on another Beckers webinar. Have a nice day.